Today we're going to be performing a postpartum assessment. The first thing we want to do is check her vitals, and those can have a little bit of a variation in them. Her blood pressure can be a little low, and that's normal for the first 24 hours or so. Her heart rate can be bradycardic, so it can be between 40 and 60, and that's normal as well. If it becomes tachycardic, anything over 110, that can be a sign of infection or hemorrhage, so you want to do some further investigating on that. Her respiration should be normal, and her temperature can be up to 100.4 and be considered normal within the first 24 hours. After 24 hours or anything over 100.4 can indicate an infection, so you want to monitor that. Before we do the assessment, you want to ask her if she needs to void. So ask her if she needs to go to the bathroom. Whenever we get to assessing the uterus, if her bladder is full, it can distend it. So you always want to make sure that you ask her if she needs to void first before you start. So first we're going to start with the breast. You want to inspect them for size, shape, symmetry, any redness. You want to inspect her nipples for any cracks, fissures, bleeding, redness, or discharge. If she has any of those, that can, and if she's breastfeeding, that can mean the baby isn't latched on properly, and it can be very painful. Discharge, such as colostrum, is normal, and that's just like the thick, milky, thick yellow secretions that come out, and that's very good for the baby, especially if she decides she wants to nurse. You want to see if her nipples are inverted or erect. If they're inverted, that can make it hard for the baby to latch on properly as well. But all those things can be fixed. You can give her support, and you can also set her up with like a lactation consultant. You want to check for any engorgement, which is when the breasts are really full of milk. It can be very painful. They can be red. You can encourage her to get in the shower and let the warm water hit it. You can give her warm compresses. All those things can encourage milk letdown. Encourage her to still continue to breastfeed and to pump. Those things can help with relief. You want to tell her to wear a good supportive bra. And also assess for pain, like if she is engorged. For a non-lactating woman, you want to also encourage good breast support. You want to teach her to avoid any stimulation to the breast or the nipples, because that can encourage milk letdown as well. And then you want to assess for any pain and rate and document that. Next, we're going to move on to the uterus. And like I said before, you want to make sure that her bladder is empty before you do that. Make sure that she doesn't have any bladder distension. If the bladder is full, that can distend the uterus up and to the right and can interfere with your normal assessment of the uterus and fundus. So to inspect the uterus, we're looking for the fundal height, and so we take one hand and place it above the symphysis pubis and one hand right at the level of the umbilicus, and when we kind of cup it like a melon to feel for it. Whenever you find the fundus, we're going to measure in finger breadths. So a finger breadth, or in centimeters, is how it's measured. It should be level with the umbilicus or a centimeter below postpartum, like the first day postpartum. So after that, it kind of goes down 1 centimeter each day. By day 10, it should be into the true pelvis and not palpable anymore. So you want to have her lie supine. In the supine position, we're going to place one hand below the symphysis pubis, or right above it, and one hand right at the umbilicus, and measure. You always want to measure in finger breadths or centimeters. So that's how you measure fundal height. You also want to make sure, or check to see if it's midline to the left or to the right. It should be midline. And you want to always make sure that you feel if it's firm, which is what it should be, or if it's soft and boggy. If it's soft and boggy, you want to massage it until it becomes firm. If not, it can lead to hemorrhage, which is a medical emergency. And then you also want to assess for any pain. You want to rate that. You can give her pain medication as ordered. Rate and document, of course. And if she's breastfeeding, you can teach her that can cause uterine contractions, which can be painful, and that usually goes away within the first few days. So next we're going to move on to the bowels and bladder. You want to ask her how much she's voiding, how often, if she's having any trouble, like if she's having any pain, any burning when she's peeing, if she feels like she's not voiding all the way, like if she's retaining any urine. It should be between like 100, 150 is what she should be voiding every time. If it's less than that, then that can be urinary retention. And she could void more than that. That could be like from all the fluids that she gets during labor. But we want to tell her, like we need to keep track of that, of how much she pees, how often, and we need to record the amount if possible. So then you also want to ask her about her bowels. We want to listen in all four quadrants. You can do that before you palpate the uterus, just so it doesn't interfere with any bowel sounds. But always listen. You want to ask her if she's passing any gas, if she's had a bowel movement yet. If she hasn't, then you want to encourage the use of her medications. A lot of times stool softeners are ordered for postpartum women because constipation is a major problem for them. So also encourage like high fiber foods and fluids, and teach her not to like hold it, because that can make constipation worse. So there's interventions for that, and you want to teach her those. So after you assess that, you want to move on to the lochia, which is the blood and discharge that occurs postpartum. You want to ask her and assess the amount, the odor, the color. The color should be bright red at first, and after several days it turns, so it'll get like a brown color and then to like a real light pink, but it should never go back to that bright red once it started changing. The amount, if she saturates a pad within 15 to 30 minutes, that indicates hemorrhage, so it should never be that much. But you always want to ask her how many pads she's saturating within an hour, the amount, and the color. The odor should be almost like that of a normal period, but any like foul smelling is a sign of infection. So we want to keep track of those and how many she's changing per hour. You also want to assess for pulling. So you want to have the patient lie down, or whenever she is lying down, you want to have her roll over to her side, and you want to assess for any pooling of blood. You can also have her kind of like raise her leg up whenever you're assessing the perineum. So after we assess for lochia and pooling of blood, you also want to check her labs. So you want to check her hematocrit and her hemoglobin postpartum and compare those with what they were before. So if they've dropped, that can be a sign of hemorrhage and bleeding. And there's other things you need to check for, like if she may need Rogam administered before she leaves. If she's negative and the baby's positive, you want to obtain a rubella titer. And she may need that vaccine as well before she goes home. So then you also want to check her perineum. If you want to have her lie on her side, and if you want to check and see if there's any redness, any discharge, any edema in the perineal area. So you want to have her roll over. You want to remove the pad from front to back. You want to assess the pad for lochia, assess the odor amount, color. You want to have her use a peri bottle with warm water and cleanse the area. You can do that while you're expecting, or you want to tell her to do that too anytime she goes to the bathroom, and do that front to back, whether she's voided or she's had a bowel movement. To just do that every time, and then to pat dry, not to rub it, because that can cause irritation. So after you've cleaned it and you've inspected, you can check the, like if she's had an episiotomy, you can make sure that there's no signs of infection, check for edema, discharge, all of that, any redness. Bruising can be normal within the first day or two to the area. You want to apply a clean pad from front to back. You also want to inspect for hemorrhoids, and you can give her like an ice pack that can help relieve the pain. There's dermoplast spray that she can spray on to kind of help numb it. You can set her up for a sitz bath and teach her how to use that, and that can provide relief as well. You want to assess her pain level. You want to rate it and document that, and you can also give her pain meds as ordered. So after we inspect all of that, you want to move on to her legs. So we're going to have her put her feet out. You want to assess for any DVTs and edema, things like that, if she has a blood clot. So you want to have her extend her leg. You want to have her dorsiflex her foot up like this. If she's having pain in her calf, that can be a positive Holman sign, and that is a sign of a blood clot. You want to check for edema. If she has any swelling or like reddened, warm area, that can also be a sign of a blood clot as well. And after you've done all that, you also want to assess her emotional support. So you just want to ask her if she's doing okay. Like, she's been through a lot physically and mentally, emotionally. It's a lot on a postpartum woman. So ask her if she's doing okay. Tell her that you're there for her. Encourage her and give her support. You want to see how well she's bonding with the baby. If she's not, encourage like skin to skin contact and kangaroo care. You can check to see if she's like has support from her partner, if her partner's bonding with the baby, if she has family support. If not, you can refer her. There's like local referrals and resources that she may need, and just always monitor her for like any abnormal signs or anything like that, and just let her know that you're there for her. So